Welcome to the AACS Daily News. The coronavirus has had a major impact on the United States, and it can be stressful for many Americans. We spoke with two mental health professionals from Fuller Hospital on tips to relieve stress during this time.
Hi, my name is Kim Rodriguez. I'm the Director of Clinical Services at Fuller Hospital.
And I'm Dale Hirschman. I'm the Director of Case Management.
So I think in light of everything that's happening in the world, we've definitely seen patients just really concerned about how this impacts their personal lives, anxiety around the unknown, and really what this means for their discharge from the hospital, how that'll impact their transition back into the community, and what that looks like also, during this time and what their treatment could be, given everything that's going on, in person versus telehealth versus, being able to see somebody right now and what that looks like. So definitely presenting some new challenges that we hadn't seen before.
Just to add to that, people feel very isolated at home and cut off from a lot of their usual supports. One area that we've been lucky enough to offer here at Fuller is we have a partial hospital program where people can register to engage in telehealth for a program for the day, which is therapeutic, helps them feel connected, would be able to build some additional structure into their day, and is available to people who are suffering from feelings of depression, isolation, or other offshoots of the virus.
Yeah, I think that we've been in a situation where we're having to be creative with how we, deliver treatment. And this is one of those ways, exactly, doing what we're doing in terms of a Zoom account and how we're able to connect with the outside world and keep people connected to a network and work with them in a way that doesn't require them coming to the hospital or exposing themselves in the community, but really they can just be in their homes, be connected to clinicians, nurse practitioners, psychiatrists, medication component, all of that is kind of wrapped into, communication via the computer. And I think one of the biggest things right now, especially with the weather, not being too bad, is definitely getting out as much as possible, but also within the restrictions of what, the CDC is putting out, even going for a walk daily and providing some type of structure to the day. That's definitely a key component to, staying healthy in a situation like this. So like Dale mentioned with the partial hospital program, it allows there to be some type of structure during the day where people can have some routine. But yeah, if just making sure that they're building things into their day so that they feel like they're on some type of schedule can definitely help.
Even writing down a schedule for yourself daily so that you have a specific time that you wake up, and exercising for a period of time, reading for a period of time, engaging in any kind of craft activities that you might be interested in. But if you keep your schedule the same or similar every day so that you still feel like you have a routine.
And there's lots of resources right now, and a lot of people in different positions that are kind of putting out things to do in your own home and ways to kind of be creative with whether it's fitness or activities, things that just kind of allow people to feel engaged in a network without having to really leave their home.
I just think it's important for people to understand that although they may be a need to stay at home, and many people are home alone, they don't need to be alone in that environment. There are places like Fuller where if they have a device or a cell phone or a computer where they can hook in to get additional resources, and that they don't have to feel like they have to struggle alone out there.
We've got a lot of different types of treatment that can still help people through this challenging time. And, like Dale said, while most of the world is kind of shutting down and being forced to isolate, working in mental health, we're open, we're running, we're here, we're supportive, and just you don't have to feel alone during these challenging times.